So, going back to this concern about the pandemic and kind of the mistrust, I do think that like not citing the fact with any regularity that being overweight or obese was the signature marker of whether or not you'd have a negative outcome is a total dereliction on the part of the public health establishment. In the United States, like being overweight was never emphasized. And in fact, it's kind of the same way with all medicine, actually. They very little conversation in the public consciousness. Yes, your doctor may indicate to you, hey, like Jason said, hey, you should cut some weight. It'd be good for your health. But beyond that, the actual sort of like the public health messaging that we have, not a lot on that issue. I think Michelle Obama actually kind of tried it with the Let's Move initiative during her time as first lady. But beyond that, like it just seems like we've strayed from pointing to like the single most obvious thing. I mean, how long has the pandemic stretched? Since March, February of 2020. We're now in 2022. A public health messaging campaign that had revolved around cutting weight, eating healthy, getting exercise, rather than just hide until we have the medicine to help you, would have been far more constructive.
Yeah, I agree. Yeah, definitely. Get more vitamin D too. How about some research into why Florida has been able to stay open? Like obviously vitamin D is important, but mostly it's even if
Southern California has vitamin D too, and they've struggled as well, and Texas has had struggles, and Florida hasn't been great. Like they've been up there among the highest states in the nation in terms of transmission and hospitalizations.
But it's silly that we're looking at one aspect of a pandemic, right? We're looking at COVID, and then we're ignoring all the effects of keeping people indoors and unhealthy, like the increase in psychiatric medication, which is a huge problem because those are really hard to get off of. People don't usually get off of them once they start. So a huge increase in psychiatric medication and in mental illness in kids, fentanyl issues, people just on drugs because they're depressed, because they're stuck inside. And so we've been like, oh, COVID cases, and just boxed off this one tiny little, well, it's not tiny, but this one aspect of locking people inside or freaking people out for 2 years. And then the other problem is, when is it going to end? Like if variants just keep coming out, is it, oh, you're only allowed out with a booster, even though you can still transmit the variant forever, right?
Yeah.
This is just ridiculous. I was in Serbia when the pandemic first hit, so in the summer, and it was really interesting to go from Florida to just kind of different area in the world and see what their response was. And their citizens were, well, in a serious war in the 90s. So they're not, and I think it was so recent that they're like, oh, you're trying to keep us indoors. One, we don't have very much money, so we need to work. And two, we've been through worse. That was basically the average, I would say, like Serbian thought. But what they did was they tried to shut everybody down, and everybody rioted, and it was a huge riot. There was like tear gas. People were like, we're not getting shut down. And then they put tents in fields. So they put makeshift hospitals in fields and just opened everything up. And they didn't end up using the hospitals, but they had prepared extra hospitals in case everybody got sick. And honestly, I don't understand why places like Toronto, who are missing hospital beds, like why didn't they just take a hotel and spend the last 2 years prepping the hotel for COVID cases and training students, if they're out of nurses and doctors, for specifically COVID? It's been 2 years. So why didn't we just empty a couple of hotels? They're empty anyway in Toronto. And then just, I don't know, open things up. So at least you have the hospital beds, if the hospital beds are the issue. Like, how can the hospital beds still be an issue if you have 2 years to find more hospital beds?
Yeah.